gentlelady, Dr. Miller Meeks from Iowa, for her 5 minutes.
Thank you, Mr. Chair, and I thank all the witnesses who are here. Dr. Walensky, you and I have had the opportunity and the pleasure, if you will, to receive testimony before and ask questions. I'm a physician. I'm also a former director of the Iowa Department of Public Health. And when it comes to trust in our agencies, if you've lost me, that means there is a lot that has to be answered for and oversight that has to be taken care of. I vaccinated individuals, all 24 of my counties in my district. I was vaccinated, but even now, there still persists this non-recognition of infection-acquired immunity, of herd immunity, of immunity that exists. And the purpose of a vaccine is to do what? It is to confer immunity. So the failures of the CDC and the FDA, and I won't get into the NIH, were both administrations. There was the first failure to not to develop testing in an appropriate, adequate fashion for COVID-19, despite the fact that there was already a test with high specificity and sensitivity from the University of Iowa. The failure of the CDC to use real-world evidence and data when studies from Israel or other countries showed that viral transmission still existed despite vaccination. The failure of the CDC and other public health organizations to acknowledge infection-acquired immunity despite data from other countries, and that there were waning antibodies within 1 month after vaccine. The failure to acknowledge infection-acquired immunity or natural immunity and mandate vaccines to those who already have immunity. And I put forth a bill to mandate that all insurance companies, public and private, cover for antibody testing and T-cell antibody testing to get to this point. The failure of the CDC to acknowledge myocarditis and pericarditis in young people and still advocate for vaccines in young men despite that risk, which, as we talked about finally last year, that there's a risk-benefit that has to be considered, but was not considered in these mandates. Menstrual irregularities in young women. I think that when you're trying to message to the public, and I can tell you as a public health director, what I conveyed to my staff was that our credibility was the most important thing that we had in public health. And so when we can't acknowledge what are common concepts and what my local public health individuals and officers and physicians and nurses were acknowledging back at home, but we're not receiving through the CDC, has created a lack of trust in extremely important institutions. The failure of the FDA to utilize their own advisory boards when approving vaccines, especially in certain age groups, and rushing approval in these age groups, and then their slowness to advance any therapeutics. And what evidence? Can you tell me the evidence-based research that shows 6-foot distancing is appropriate? It's demoralizing and it is depressing that agencies that were once held in such esteem cannot translate and transfer research and evidence and respond to real-world evidence when they come up with strategies and policies. It's not just a messaging problem. It was a problem of bias within the agencies.